Hi, good afternoon, everyone. Hi. Yeah, my name is Jung Sun Yu, Associate Professor and Program Leader of a Master in Medical Physics program. Thank you very much for your valuable time to learn our program on even Saturday. Thank you. Thank you for coming. So today I will briefly introduce about a general aspect of a Master in Medical Physics program. Okay, so let me introduce our leadership of our program first. So Professor Jing Chai, as you can see here, yeah, so he is actually the founder of our program. So he has a great leadership in medical physics world. And so he launched our program in 2020. He received a bachelor and master degree um, and in physics and his PhD in the University of Virginia. And then he completed the residence program at the same university. So after a couple of years, he became the certified medical physicist in the United States. And he also have an extensive academic career in medical physics. So he was an assistant and associate professor in the Duke University Medical Center before he moved into the PolyU in 2017. Since 2017, he has been working as an associate professor and professor in the PolyU, and he launched the Master in Medical Physics program in 2020. And now he's a scheme chair of a postgraduate scheme in health technology and an associate dean of our faculty. So his research interest involves artificial intelligence, deep learning, and big data analysis for application in radiation therapy, as well as for novel medical imaging technique development. Okay, so I also received the physics training in the Seoul National University and also did some research fellowship in the National University of Singapore. And then I started my academic career as BK Assistant Professor in the Seoul National University. And since 2016, I've been working in the PolyU as assistant and associate professor. So I've been working as a deputy program leader until just recently. And from 2023, I became a program leader in our medical physics program. So my research also involves novel imaging development in molecular imaging, nuclear medicine imaging, as well as multimodality imaging. So Dr. Tian Li is a young, passionate researcher in medical physics. He is a deputy program leader. He received a bachelor degree in Peking University, master degree in Duke University, and PhD in our university. And he has been working as a research assistant professor and assistant professor in the PolyU since 2021. And he's now working as a deputy program leader. So his research also involves artificial intelligence, deep learning, radiation therapy, and novel medical imaging technique development. Okay, so as you may know, PolyU is a well-recognized university by QS University ranking. So it has been marked as a 65th in World University in 2024 and 6th in the top 50 under 50 university in 2021 and 26 in Asian University. So you can also see remarkable improvement and performance of PolyU in Times University ranking. So we have more than 27,000 students in 30 academic units, as well as 160 top postgraduate programs. So our Master in Medical Physics program is one of the top master programs. Okay, so our program is belong to the Department of Health Technology and Informatics, in short HTI. So we have a very competitive bachelor program in medical laboratory science and radiography, and also very well-known top postgraduate program. medical laboratory science, medical imaging and radiation science, and we launched our program in medical physics in 2020-2021 academic year. So if you pursue a higher degree, such as PhD in medical physics, you can also see lots of opportunities in our department. Okay, so in 2020, September, our program was launched and it was well recognized by Hong Kong Medical Society and the public. Yeah, so then let's move into the definition of medical physics. So you may have some understanding of medical physics, but may not know what exactly medical physics is. So medical physics is an interdisciplinary field in which the concept and method of physics are applied to the diagnosis and treatment of human disease. So here are some keywords. Interdisciplinary. So medical physics involves different areas, including medicine, physics, as well as engineering and other fields. And we utilize a physics principle to diagnose and treat human disease. So specifically, medical physics is involving largely radiation therapy and imaging physics. And there are also health physics, engineering physics, and some other illustrations. Okay, so if you look at the structure of a clinical oncology department in the hospital, so you would know the role of medical physicists more clearly. So there are clinical oncologists first, so who are making medical decisions, and they usually have medical degree, MD, and you may also familiar with the radiation therapist. So they are actually doing real operation of machine, and they are treating and managing the patient. So they usually have bachelor degree or master degree. And in between, there are medical physicists. So they are not very clear in patient treatment, but behind the clinical practice, they are doing a key role for patient treatment. So they are working for technical adaptation, for radiotherapy treatment planning, and as well as diagnostic imaging. And basic degree to be a medical physicist is master degree. And a lot of them also have a PhD. Okay, so medical physics, the workforce has been steadily growing in the past 50 years. So if you look at this graph, you can see the number of members for AAPM, American Association of Physicists in Medicine, has been increased a lot in the past 50 years. So also in Hong Kong, so with a lot of new hospitals construction and aging trend, there is a huge demand for medical physicists. So currently there are only about 150 or 200 medical physicists in Hong Kong. So mostly working in oncology center or radiology department or medical nuclear medicine department. So if you look at certification pathway in medical physicist, you will see it starts from resident physicist. So you should start from resident physicist, which is more like a on-job training. And then a couple of years later, you will become a qualified physicist. And after the examination of both, then you finally become certified physicist. But to start as a resident physicist, you need degree, so at least master degree, which was missing in Hong Kong before we launched our program. So our program is the first dedicated program in medical physics in Hong Kong. Okay, so if you look at mainland China, nearby region of Hong Kong, then there is even higher demand for medical physicists. So you can see China radiation oncology market is expected to have a growth of 11% or 13%. So indicated by the increase in radiotherapy machines and proportional. But it is only estimated by increase of machine. So if you consider aging trend and economic growth, there will be much higher growth rate. And on the other hand, there is a severe shortage of medical physicists in mainland China. I actually see our graduate from mainland China or our graduate going to mainland China, they usually get a job as a medical physicist very easily. So a rough estimation of the need of additional qualified medical physicists is about 2,500. So this is estimated with current equipment level. So if you also consider aging trend and increased need for healthcare service, then it is expected to have more than 10,000 medical physicists shortage. Okay, so medical device industry also provides a huge opportunities for our students. So you see there is a big growth for medical device industry in the world and also China. So 30% increase in all equipment from 2023 to 2028 is expected. And if you look at imaging devices specifically, you can see 30% increase is expected from 2023 to 2030. And if you look at Chinese market, China medical device industry, the demand or growth is even higher. So it requires only 2 years to have a 30% increase in all equipment. Okay, so then let's move into the structure of our Master in Medical Physics program. So Department of Health Technology and Informatics is doing a key role for our medical physics program. And we also have a very close collaboration with the Department of Applied Physics, AP. And other departments are also involving in our program, such as Applied Mathematics, Biomedical Engineering, Computing Science, Electronic and Information Engineering. So we also have very good connection with the local hospitals as well as medical industries such as Varian or Siemens, United Imaging, and also Medical Physicists Society. Okay, so let's see the overview of our program. So the main mode of instruction is English. So we have mixed mode, including full-time and part-time mode. So you can apply either full-time or part-time study. So for full-time students, it is required to take about 1.5 years to complete your study. And for part-time students, it is required about 3 years to complete your study. But it doesn't mean you need to spend a whole 1.5 years for full-time study or 3 years for part-time study. So as soon as you complete 30 credits, you can graduate. And we actually see quite a number of students graduate within 1 year for full-time students. Tuition fee is 6,000 Hong Kong dollar per credit. In total, it will be 180,000 Hong Kong dollar. And I would like to emphasize that we secured some government fellowship schemes. So last year, a total of 5 fellowships were awarded to local students. So it provides about 120,000 tuition fee per student. Okay, so maybe you are interested in this part, entrance requirements. So we required candidates to have a bachelor degree in physics, applied physics, engineering physics, or bachelor degree in all natural science, mathematics, or field of engineering, or radiography, or other health technology. So if you are not a native speaker of English or your bachelor degree in universities main medium of instruction was not English, then it is also required to provide English exam score 80 or above for IBT TOEFL, 6 or above for IELTS. So please note that for radiographers, our program is recognized by hospital authority for promotion to radiation therapist 1 and radiographer 1. So senior therapist and senior radiographer. But for radiographer 1 promotion, it is required to take 3 elective subjects which are relevant to diagnostic radiography. Okay, so they are basic requirement, but for our selected candidates, we usually have an interview process. So it is very important to show your passion and your commitment in medical physics during interview. Okay, so this is our program curriculum. Our medical physics program curriculum is aligned with the international standards for medical physics graduate education. So we have a compulsory subject, 1 compulsory subject, research methods and biostatistics, and 7 core subjects corresponding to 18 credits. Radiation physics, radiation protection and radiation safety, human anatomy and physiology. But for those who already studied the anatomy or physiology in your undergraduate study, you may also take more advanced anatomy subject, multiplanar anatomy. And we have 2 core subjects, 2 key subjects, radiation therapy physics, medical imaging physics. And we also have radiobiology for medical physicists and ethical issues in medicine and research. So these core subjects are subjects that you need to take, that you must take. And we also provide extensive list of elective subjects. So you can choose 9 credits from elective subjects. Clinical practicum, which is providing clinical training in the local hospital by clinical physicists. And dissertation, so if you are interested in pursuing PhD, then it will be very good to take dissertation subject. And we also have a practical radiotherapy treatment planning subjects, which was specially designed for medical physics students to provide a hands-on experience in radiotherapy treatment planning. And multiplanar anatomy, advanced radiotherapy planning and dosimetry, digital imaging and PACS, advanced radiation protection, and we also cover all the major imaging modalities, such as CT, MRI, nuclear medicine imaging, as well as ultrasound imaging. And there are also other subjects, such as molecular imaging and functional imaging, virtual reality in healthcare, and so on. Okay, so this one shows the structure of our teaching staff. So mainly, we rely on 7 core medical physics teaching staff, and also there are 20 more other polio staffs involving in our teaching. And we also have a guest lecturer from practicing medical physicists, as well as a practicing oncologist and radiologist. And overseas scholars in medical physics field, they are also involving in our teaching. Okay, so here are core subject leaders for our 7 core subjects. So Professor Jing Kai is the subject leader for radiation therapy physics, and I'm teaching medical imaging physics. Dr. Kelvin Wu is teaching human anatomy and physiology. Dr. Fiona Chan, who is actually MD, is teaching ethical issues in medicine and research, and Dr. Liang Ting Lin is teaching radiobiology for medicine and for medical physicists. And from applied physics department, we have 2 teaching staff. Dr. Casey Wang is teaching radiation physics, and Dr. Albert Choi is teaching radiation protection and radiation safety. Oh, sorry. Okay. And then we also have a number of clinical educators, so our clinical physicists who are providing clinical training for our students. And we also have a lot of visiting lecturers from local hospital and medical physics society. Okay, overseas scholars who have expertise in medical physics are also involving in our teaching. And with their help, we are providing distinguished guest lecture series in medical physics. Okay, so our teaching labs well equipped with up-to-date equipment for radiotherapy and medical imaging. So here you can see simulator and radiation therapy planning workstations, which are really identical with the ones in hospital. And we also have a virtual reality-based radiotherapy planning equipment. And here you can see 3 Tesla GMS MRI, which was recently installed in the Poly. Okay, so career path. So after completion of our program, master degree, you may pursue different career paths. So the first one is, of course, to be a medical physicist in hospital. And you may also work in medical industry as a research personnel or etc. And you can pursue PhD degree in medical physics after completion of a master study to work as a professor or academic staff. And we also have some graduates who are working as a government regulatory officers or enterprises. Okay, so we provide some opportunities such as a scholarship, including government fellowship, merit-based scholarship, and research assistantship. And also networking opportunities, since more than 30 local professionals are involved in our teaching. And you could also have some local or non-local placement or exchange. And then if you want to have research experience, there is huge opportunities for that. So our staffs are having more than 20 research grants, including 40 million Hong Kong dollar funding. So we also have some collaboration with the international scholar. So you can have an in-depth research experience in medical physics. So for our full-time students, we see they are openly working as a research assistant and having research assistantship. Okay, so this is a general overview for the past 3 years. So we admitted 73 students, including 15 full-time and 58 part-time students. And among them, 28 were graduated, and we secured 9 government fellowships. And we received lots of admission from various bachelor degree universities, including 5 major Hong Kong universities, and some well-known universities from mainland China and UK, Canada, Australia, as well as New Zealand. And our graduates are working in various countries and regions as well. Okay, so we actually performed a very brief survey for our graduate. Okay. Yeah, so you can see employment status here. So you see about 30% are working as a medical physicist, resident medical physicist in hospital. And some of them are working as a PhD student, and some are in industry, medical industry, and some are working as a other medical professional in hospital. Yeah, so our graduates are working in various countries and regions. So for example, in Hong Kong, they are working as a resident physicist and medical physics PhD students, or some are working in medical industry. And in mainland China, medical physicists and medical physics PhD students. And even Japan, there are some students who are doing PhD study. And in UK, some are working as medical professional in the hospital, and some are working as in medical industry. Okay, so we also asked, did getting a master degree in medical physics lead to a change in your job or position? And you can see, so 50% of them said yes, and then about 23% of them said not yet, but willing to do. So it's quite a high portion of students who said our program actually changed their job position or willing to change it into medical physics world. Okay, so we also ask them what aspect of the math and medical physics program at the PolyU have been beneficial for your career. And you can see some answers. So the program is comprehensive and internationally competitive. So we have very good connection to Hong Kong local hospital, or have to start a new career in a new place. And it was useful for promotion. And so it was useful to solidify and reinforce my knowledge, update me with two new technologies. And lastly, we ask overall satisfaction on our program, and they answered it's about 4.3 out of 5. So if you think about SFQ score, it's very high. So a lot of them agreed or strongly agreed that our program was satisfactory. Okay, so you might be interested in last year's statistic. So last year we received 103 applicants, and then we admitted 26 students, including 53% of full-time students and 46% of part-time students. And for part-time students, they usually had about 7.5 months median working experience, and GPA, mean GPA for admitted students was 3.02, but of course, there were quite a number of students having very high GPA, higher than 3.7. And 90% of them were from QS top 100 universities, and male to female ratio was quite balanced, 67% to 23%. And we also have very diverse background, including 23% of physics students, 42% of engineering students, 19% of radiotherapy students, and others. Okay, so this is the end of my presentation. Thank you so much. Thank you for your attention.